Support for this episode comes from Gvoke HypoPen. Now that Benny is on his own more and more, I'm grateful that he's open about his diabetes journey and always tells his friends how to use his emergency glucagon, Gvoke HypoPen. Gvoke HypoPen is a ready-to-use rescue pen for treating very low blood sugar in people with diabetes ages 2 and above. If you take insulin or sulfonylureas, you are at risk for your blood sugar going too low. Low blood sugar emergencies can happen unexpectedly, and they demand quick action. You need a safety net when it matters most. Be ready to treat a very low blood sugar with Gvoke HypoPen. Find out more, go to gvokeglucagon.com/Stacy. That's gvokeglucagon.com/STACEY. Gvoke should not be used if you have a tumor in the gland on top of your kidneys called pheochromocytoma, or if you have a tumor in your pancreas called insulinoma. Visit gvokeglucagon.com/risk for safety information.
This is Diabetes Connections with Stacy Sims.
This week, the concept and practice of screening for type 1 diabetes has changed significantly. Years ago, it was maybe something you heard about at diabetes camp drop-off or at a conference, and then when you got your information, you weren't quite sure what to do with it other than knowing it went for research. These days, you get actionable results with the approval of Tzield and potential development of other prevention treatments. But what do people with diabetes actually think about screening? Beyond Type 1 asked, you answered, and we're talking about it. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. Always so glad to have you here. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. I'm your host, Stacy Sims. My son was diagnosed with type 1 18 years ago. Yep, it's December, so his diversary is the very beginning of this month. Benny is almost 20. He was diagnosed right before he turned 2. I can't believe it's been 18 years. For those of you who have been in the community for that long, maybe you remember the milestone I always think of in terms of technology is that Lantus, long-acting insulin, was just approved for toddlers. So we immediately started on MDI, multiple daily injections. He did not have to use NPH or regular. He did not have to eat at scheduled times a day. And we thought that was absolutely amazing. And wow, the technology was so incredible at that time. And we were right for 2006. Benny really is doing great managing his diabetes completely independently these days. I do help him out a little bit when it comes to ordering supplies because that still stinks. But I don't follow him on Dexcom. I do know, high level how he's doing. And longtime listeners will know that he treats it all, let's just say with a sense of humor. But he seems to really respect type 1 diabetes, which is, for a 20-year-old is really all I can ask right now. Okay, this week's episode is all about a survey called The Cost of Not Knowing. And this was commissioned by Sanofi, done by Beyond Type 1. And some of the findings came out a few weeks ago, but I wanted to really dig deep here because this was really about receiving a type 1 diagnosis without prior warning. Most of us had no prior warning, whether it was for yourself or for your child. As I mentioned in the tease right at the beginning of the show, screening was very, very different a decade ago, for most of us less than a decade ago, because you'd have access perhaps at a conference or at camp. I mean, I did it. I went through TrialNet years ago because you had to be younger than 40 at the time. I don't know if that's still the rule. That was years ago. And I remember getting the results back and seeing that I didn't have the autoantibodies and thinking, well, okay, it's my husband's fault. I know, right? Isn't that awful? And then my cousin was diagnosed with type 1 like a year later. So I kind of remember thinking, well, what the heck am I supposed to do with this information? And there was no follow-up and there was nothing we could do. And that has changed a lot. I'm talking to Christian Hurley, who leads programs, advocacy, and health equity for Beyond Type 1. We did this interview right at the end of October. So we are talking about Diabetes Awareness Month, which of course was November. It has passed. But I kept that in because the information she's talking about is something that they launched at that time and is now part of Beyond Type 1. And I will link up all the information that you need to find that. Our conversation is right after this. You know I'm a big fan of choice when it comes to diabetes technology. I get so excited when there's something new. If you live with diabetes, you deserve to find the best fit for you. That's just one reason I'm working with Omnipod to help spread the word about what makes it so easy to test their system out. If you want to try an insulin pump or see what life without tubes is all about, you can try Omnipod even if your current tubed pump is in warranty. Really, you heard that right. And if it's not right for you, no problem. Omnipod does not tie you down with a contract or a tube. Go to diabetes-connections.com and click on the Omnipod logo. Terms and conditions apply. For full safety risk information and free trial terms and conditions, visit omnipod.com/diabetesconnections. Christian, welcome to Diabetes Connections. Thanks for spending some time with me and my listeners. I'm glad to have you here. Thanks for doing this.
Of course. No, thank you so much for having us. I'm super happy to be here.
Yeah. So give us the overview of what you all found, because we can get into it, but I found that kind of surprising. But like high level, start us off.
So one of the things we want to talk about today is our cost of not knowing survey. This was an effort that we undertook where in March 2024, we fielded two surveys, one for adults living with type 1 diabetes and another for caregivers of individuals living with type 1 diabetes. And the goal was really to understand the impact of a T1D diagnosis on an individual's sort of emotional, social, and financial health. Like, how does this diabetes diagnosis affect the whole person and the family? And we also wanted to assess sort of whether early detection through early screening, autoantibody screening, may have helped to sort of mitigate some of the impact of that diagnosis for families. Yeah, we found lots of different things that were illuminating and has really helped us to share this story and advance this goal of ours to get more people interested in screening early and assessing their risk for T1D in particular.
It's really interesting to look through this because just anecdotally, I know a lot of families of kids who were diagnosed even before we felt that screening would lead to action, right? There wasn't much we could do when my son was diagnosed almost 18 years ago. And there's this kind of chatter of like, well, why do you want to really screen? What do you really learn? But I was surprised to find that you really did, when you dig in, find these costs. So let's talk first about the emotional cost here, because I wasn't thinking about it that way. But when you think about what goes through a surprise type 1 diabetes diagnosis, it's devastating.
Absolutely. One of the things that we found was, 64% of adults with T1D talked about how their emotional health overall declined upon hearing that initial diagnosis. And I think some of the other data highlights some other reasons why, but we also found that individuals had to, in many situations, change future goals or make adjustments to their life that were kind of traumatic. We talk to young people who have been diagnosed, for example, say in their senior year of high school,
Yeah.
and, this is a situation where, your life is changing, how you can certainly still learn to thrive living with T1D, but there's a learning curve. How am I going to now be able to manage this? And for kids who maybe had planned to go off to college, we learned from this survey and just from our community that many young people have to say delay college or choose a school close to home where they can stay with family. And I think that's just a good example to bring that to life. When people talk about a diagnosis really having to shift and alter plans, it's not just a vacation, it's major life changes that people have to make in order to sort of adjust to this new reality with living with type 1 diabetes.
And I probably shouldn't have jumped right into the results without talking a little bit more about the setup here, about why I mentioned, and I always feel like my listeners are familiar, but just in case this is one of your first times listening here, we're talking about the ability to diagnose type 1 diabetes before it really presents. And I think there's a reluctance among a lot of people in the community to do this because, we kind of think, well, we'll be fine. Like, especially if you have a kid with it, you're like, you'll be fine. You'll know that your sibling has it. If God forbid you have to go down that road. And then what do you do with it? So before I keep jumping into the numbers, Christian, maybe you could just back up and talk about Sanofi, their involvement here, and what's available now when people are screened.
Yeah, so Sanofi commissioned this survey with us. And from the perspective of Beyond Type 1, we are very much focused on this didn't just come about today.
Mm.
This work started many, many years ago with Beyond Type 1 when we started talking about the signs of diabetes and trying to reduce individuals being diagnosed in crisis, something that is called DKA, diabetic ketoacidosis, this prevalence of people that were losing their lives because of a lack of awareness and knowledge around type 1 and what the signs might be and what their overall risk might be. I think in being able to commission this survey with Sanofi, certainly there has been some innovations and some new things that can happen in that type 1 could potentially be delayed with some of our newer medications that we're seeing. However, what we like to talk about even more over and above that is the fact that, again, some of the things that we learned from this study, it's incredibly helpful for people to know and be aware of the risk that is going to be affecting their family members. So whether you are someone who is living with type 1 and you feel like, well, I've got it. I know what to look for in the signs. We have a significant number of people in our community that talk about the fact that they did not see any signs
Yeah.
upon their diagnosis, right? That this was still a surprise diagnosis. And also, there's new data out that highlights the fact that while your risk is increased 15 times if you have an immediate family member, we also know that over 90% of individuals who have been diagnosed with type 1 have absolutely no family history.
Mm.
So yes, it's true that the type 1 families, maybe they are a little bit more hyper focused, right? And may choose to deprioritize screening, although we still recommend that families get tested so that they have this information. But we also really need to make sure that the general population understands that really everyone is at risk for type 1 diabetes. And they need to be able to be very proactive in assessing what is my risk? Do I have the autoantibodies now that this is becoming more broadly available? Beyond Type 1 has created resources to assist our community members to have this conversation with their clinician, to request the screenings that they need. We even give them the codes and the names of the test or the blood test that you need to ask your clinician, because it's really
Wow. Yeah.
important to empower people. Because sometimes with their primary care doctors, they're unaware exactly on how these screenings work. And so it's just really important. So yes, direct family members, they might have a little bit more information about that type 1. But again, over 90% of our new diagnoses for type 1 are in individuals who have no family history. So that means everybody needs to be aware. They need to know their risk and they need to go ahead and be proactive so that they can reduce sort of the traumatic instances of being diagnosed in crisis.
When we dig into the survey, though, and you just mentioned, an emergency diagnosis or diagnosis in crisis, I should not have been surprised, but I was when you all broke this down by financial burdens, because requiring emergency care is a surprise emotional burden, but it's also a financial one. Can you talk about what these survey results showed?
Absolutely. So certainly. So again, we talk about being diagnosed and that it can often be a traumatic event. If you're diagnosed in the emergency room, very often in DKA. And so what we found is that nearly 9 in 10 adults, it's 88% of those surveyed with type 1, required an emergency visit, required an emergency care for their type 1 symptoms before or during diagnosis. And what that translated to is about half of those individuals spent at least $5,000 on that
Wow.
emergency care. And then nearly 1 in 4, that's 24%, spent at least $10,000 in that emergency sort of setting of being treated and potentially being diagnosed. And so that was one of the things that really struck me, because to your point, you can talk about the emotional impact, and they are many. You could talk about the critical importance of getting out in front of this, but not only are you being diagnosed with a chronic illness that you're going to have to then live with for the rest of your life, and you're dealing with that, but a financial burden of a surprise $5,000 hospital bill or a surprise $10,000 hospital bill, that is something that is very tangibly destructive for families. There are a lot of families that do not even have $1,000 in savings, let alone, 5,000 or 10,000. And so, again, it just further speaks to the critical importance of assessing risk so that potentially you can get a softer landing as it relates to your diagnosis, and you don't have to have that emergency room visit where everything is sort of a surprise and you don't know what it is, you don't know where type 1 is. And so getting early screening allows you to know that risk, to be on the lookout for those signs, to be being monitored by your clinicians, but also gives you time to learn about type 1 and to join our community. And so again, it really provides a softer landing and could potentially help families not find themselves in financial distress due to these kind of unexpected hospital bills.
Yeah. What about the cost of the screening itself? Because we don't talk a lot about that, but is it difficult to get these screenings? I mean, that's a lot of money to spend on emergency care. Is there a cost involved? Right back to our conversation. But first, Diabetes Connections is brought to you by Dexcom. Diabetes doesn't always have to interrupt your day. Dexcom G7, a continuous glucose monitoring system, sends your glucose numbers to your phone or receiver. Know where you are and where you're headed without finger sticks and without interruptions. Dexcom G7 is the most accurate CGM, and it's covered by Medicare. Learn more, go to diabetes-connections.com and click on the Dexcom logo. Finger sticks required if symptoms or expectations do not match readings. See user guide for instructions. Data on file must meet coverage criteria. For full prescribing information on risks and benefits, visit Dexcom.com.
So we do have some toolkit resources, and in those, we do provide individuals with a list of organizations, places like Quest Diagnostics, Enable Biosciences, LabCorp, where you could just walk in off the street and request these tests. They do have a cost. Costs do vary. Some of these costs can be $30, maybe $50, likely less than $50. That's just if you walking up the street and you don't, you not necessarily have those ordered by your clinician. We do always recommend that you start with your primary care physician because it depends. If you've got a direct family member with type 1 diabetes, you can absolutely access a free screening for autoantibodies for type 1. There are different programs that will send a kit to your home. You may be able to access that to your clinician. So you always want to start there. And then you can also just have this conversation with your clinician. You can talk about why you feel like you might be in need of this autoantibody test. We give you a whole discussion guide. Upon that, we give the test that you can ask for and the codes for the clinicians to be able to use. So there is certainly instances where your clinician will be able to get that done through your insurance and be able to get that process. But we wanted to make sure that we gave people just as many options as possible. So you start with your doctor, you talk through the family history, why you think you might be at risk, and assess whether or not you can get that under your insurance. And if you can't, then there are other options where you could certainly go into a lab in communities and be able to access a screening. And then beyond type 1, we have actually been going around the country and doing screening events and providing free screenings for type 1 diabetes. And so far, we've done that in the city of Detroit. We've done that in Atlanta. We're going to have an event coming up in Dallas soon. And in 2025, we expect to be in at least 5 more cities where we'll be able to go and really be able to raise some more awareness around screening and provide free screenings to community members.
So let me ask you about that, because you've already mentioned, like, we have to go outside just the type 1 community and start screening the general public to really make an impact here. Is that happening at these screening events? Are you having success reaching beyond the community? It's got to be really difficult.
Yes, I think that we are. I think because Beyond Type 1 is a unique organization. We were founded by Nick Jonas and Juliette de Bobigny almost 10 years ago. Next year will be our 10-year anniversary.
Wow.
And because of that sort of celebrity start, we definitely approach things from a different perspective, very heavily focused on storytelling and lived experience and drawing in influencers and people that can help us to amplify our stories. And so when we do our screening events, we do it in that sort of vibe. We don't just go in and just have a screening event, but we go in and we do it in partnership with partners like the NFL Alumni Association, or we did a big event in Atlanta with NASCAR. And one of the drivers actually wrapped his car in Beyond Type 1 and messages around signs and screening. And we had a screening event right there on the grounds of the NASCAR event. And so we gave tickets away for those who attended to be able to then attend the race. So when you wrap events like this around sort of major iconic events or in partnership with really fun partners like the NFL, Alumni Association, NASCAR, and others, we see that we're able to not only engage our diabetes community, our type 1 families, because we want them to come out too, right? We want them to have access to that opportunity for their caregivers and family members to be screened, but we also want to reach that general population who's just curious and might be a part of that. More than 90% of folks who get diagnosed with no family history so that they can learn more about type 1 and have the opportunity to get their autoantibody screening.
I was really fascinated, and again, probably shouldn't have been surprised by this, but you did survey people who went autoantibody screening, and when they got those results, they were a lot less fearful. Can you talk about those results that happened to the adults who were screened?
Yeah, absolutely. I think, that's one of the positives around it. As we talk to community members around the country, a lot of times, people might say, I don't want to know.
Mm-hmm.
It just, worries me to even think about it. And so what we try to do is talk to people about that and let them know that, it's important to be proactive, get the information that you need so that then you can plan. And I think what we saw is that people who did take advantage of those screenings had the opportunity to sort of come to terms with it, to be able to learn a little bit more, to be able to, maybe get their care team in order for, if this was going to be something that was on their horizon. And so it does, it does have a sort of supportive mental health component where people are able to have that softer landing, learn more, get prepared. And it doesn't seem to have that sort of as devastating an impact on individuals as you might expect if they don't get out ahead of it. I think one of the things that always sticks out, because folks will often ask, well, what do you recommend, or what do you want, community members to be thinking about? And I always just go back to the caregivers and the individuals living with diabetes who took the survey. And what we found is that about 68% of the adults living with T1D really express a great deal of regret in not taking an autoantibody test to better understand their risk and their understanding of whether or not they were going to get type 1. And even more than that, I think what surprised me, so that's 68% of people who are living with type 1, but 93% of the caregivers actually said that they truly wish that they had learned about their loved one's risk for developing type 1. And so again, it's, don't take it from me, take it from the individuals who are going through this and who are living with this, and caregivers who are supporting their family members or loved ones with type 1 is just such a critical thing. And so I do encourage people to hear those voices, that plea that, it is a really important thing, whether you want to know or not. That might be something that people have to work to overcome, because the folks who have gone through it wish they had known and who had taken the opportunity to have those conversations with their doctors and to be proactive and to assess that, to go ahead and get that autoantibody screening. So I found that to be very eye-opening to hear that from caregivers and from individuals living with diabetes.
So I'm sure you're going to be doing a lot during Diabetes Month. Is there anything in particular you want to point listeners to that's happening in November?
Certainly. So one of the things we're really excited about that's coming up in November is we have a new initiative called Beyond Diagnosis. And it's all about helping individuals who are in that sort of first 100 days of diagnosis, newly diagnosed families, and giving them sort of the basics of the information that they need to be able to survive and thrive with diabetes, and doing it from the perspective of, we like to talk about resources from the community, by the community, for the community. And so these resources have been developed by our team, more than half of whom live with type 1 or type 2 diabetes. They've achieved ADCS, favorably reviewed status from the Association of Diabetes Educators. And they're just really wonderful resources that we'll be launching during November, during Diabetes Awareness Month. And we'll also be doing a campaign around that, where we will be calling on people within the community to give us feedback on these resources, to share them with community members, to help make sure that they are co-creating these resources with us as well. And so we love that opportunity for us to be able to, of course, help our newly diagnosed families, but also give the folks living with diabetes an opportunity to co-create and to add to some of these resources and tell their own stories of some of the challenges they faced when they were newly diagnosed in order to really inspire and give hope to individuals who are just now joining the diabetes community. We're really excited about that. We'll share more as it launches, but we're thrilled to be releasing those toolkits for type 1 as well as type 2, as well as in Spanish. We will have all of those resources available kicking off in November. Just, really encourage people to learn more. They can find all of this information on our website, which hopefully you'll share, where they can learn more about this data and the survey. And then if they sign up as a ambassador with Beyond Type 1, we'll send them out our toolkit. And that is where you'll find all of these resources that I just spoke about, discussion guides with your doctor, what the different tests are, where the different screening locations would be. And so we encourage people to sign up so that they can receive those resources.
Awesome. Well, thank you so much for sharing the information. We really appreciate it. And keep us posted on, where you're going. And I'll link up more information about the toolkit as well. Thanks so much, Christian.
Amazing. Thank you. Thanks so much for having me.
You're listening to Diabetes Connections with Stacey Sims.
More information on Beyond Type 1's programs, more information about the survey and all of that over at this episode's homepage. That's diabetes-connections.com. You will also find out more about Mom's Night Out. Registration is opened for our next two events, Atlanta in January and Cleveland in February. We will also be in Minneapolis and Phoenix this fall. The early bird special for Atlanta is ending soon, so please take advantage of that. These events are so much fun. It's a chance to learn about technology and meet local moms and women with type 1 in your community, and hopefully keep those ties going after we leave town so you can have your own meetup groups and support system on the local level. All right, thank you to John Buchanan from Audio Editing Solutions. Thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.
Take control of your diabetes with a broad range of diabetes management supplies from EdgePark. The latest diabetes supplies and continuous glucose monitors from top brands simplify blood sugar management. EdgePark accepts most insurance plans, and Medicare and Medicare Advantage cover certain devices. Plus, EdgePark takes care of the insurance paperwork to make ordering as seamless as possible. Go to diabetes-connections.com and click on the EdgePark logo to learn more about EdgePark's diabetes supplies and CGM devices.